and then I will spotlight Shanti. Yeah, so please unmute yourself, Shantiji, and yeah, just briefly tell us about the problems that you face.
Yeah. Thank you so much, Swamiji and brother. It's my fortune to talk to you directly. I am diabetic for past 10 years plus, and I have a lot of control over my food, and I do exercise regularly every day at least 1 hour. And in spite of following all the protein-rich food and everything, my readings are still not so satisfactory. It has come down, but not like non-diabetic, not in that range. And I do see symptoms, like in my eyes, there is blurriness, and in my feet also, there is some numbness. So I want to get a cure for all time.
Okay, for that you need to understand why these problems are happening. See, pulling down the sugar level is pretty easy. I can tell you how to pull down the sugar level to whatever you want. And you also need to know that hyperglycemia is not that fatal. Hypoglycemia is very fatal. That means if your sugar level goes down, your body will not be able to survive. Right? Now, by pulling down the sugar level, we have not been able to take even a single person out of diabetes in the last 100 years. Rather, complication increases. Because even if your problem has to be solved, there is energy which is required, isn't it? If your body solves your problem, what will it require? The first thing that it will require is energy. The second part is if you want to have a high protein rich diet, then you should become an animal. Because they are designed for a high protein rich diet. They eat fibers throughout the day, isn't it? You are not supposed to eat those fibers, just grass and those kind of stuff. What is your problem? The food, when you eat the food, it doesn't get converted into the right metabolites. This is called as Amavata dosh in Ayurveda. This is called as Amavata dosh in Ayurveda. Your liver is weak, your digestion is weak, and over and above it, if you put too much stress on your body, you'll become weaker and weaker. It will not help. So if you do a lot of exercise, it will make you even weaker. Right? The first thing is that you need to correct your metabolism. How to correct the metabolism? Is there a medicine which can correct metabolism? We haven't seen in the last 100 years there is a medicine which can correct metabolism. But who can correct it? Your body can correct it. Because your body is designed for it. Let me tell you, even if Ishwar comes, he'll not be able to correct your body. It's your body only which can recover itself, because it's been designed in such a manner that it recovers by itself. But then you would need to increase the recovery strength. Now, what is metabolism? I can describe metabolism in many ways. One of the ways I'll describe metabolism in terms of Kumbhak, because it is very practical and you can correct it. You can actually increase the metabolism. By describing it in a hypothetical manner where you can't correct it, it doesn't serve the purpose. That is what allopathy has been doing in the last 100 years. They don't know the reason for any disease. Do you know it? Do you know this? The current dispensation of medical narrative, they don't know why diabetes happens, why blood pressure happens, why heart disease happens, why cancer happens. People who don't know about the disease, they are treating disease across the globe, isn't it? Strange. You haven't asked this question to yourself. So, metabolism in terms of breath hold, I'll describe it as the first basic step how you can improve your metabolism is your time of inhalation has to be, rather time of hold has to be 4 times the time of inhalation. This is the first basic requirement of metabolism. There are many other steps, but then I'll describe it in a basic step. First step, time of hold of your breath has to be 4 times more than the time of inhalation. Now, having said it, you can improve your metabolism, but also you need to, whenever a therapy is designed, you need to address every aspect of your life or your body, isn't it? So it is important that you do a holistic kind of a module where the metabolism also increases. And let me tell you, we have done the world's first scientific research where we have correlated Kumbhak with mitochondria health. So diabetes can also be defined. One of the way to define diabetes, the primary way to define diabetes is how we have described in the webinar. Another way to describe diabetes is metabolic health. Right, metabolic. Another way of describing diabetes is mitochondria health. Because the primary symptom of diabetes is weakness that you all people face, isn't it? जितने भी लोग यहाँ पे हैं सबको मालूम है ना कि आप weakness primary symptom. The primary symptom of diabetes is weakness. Mitochondria is the powerhouse of your cell. Mitochondria health decreases, diabetes happens. So the research says within 4 weeks, mitochondria health can be improved drastically through Kumbhak. Now, the only question is, do you want to do it? Or you just want to pull down the sugar level, which has not shown any result in the last 100 years. And I can tell you ways and means to pull down your sugar level very drastically fast, but then there will be a survival question. You take any kind of a diuretic, natural, unnatural, synthetic, chemical, whatever diuretic which pulls down water from your body. Your sugar level will go down. If you increase the dosage, accordingly, your sugar level will go down. But then there is a chance of crash. By pulling down the sugar level, you are actually not doing any good to your body. That is why even if there is a protocol of this much sugar level has to be there in your body, but maintaining a sugar level hasn't helped anybody. The prognosis is never good. You get into different kinds of disease year after year and problems year after year. So we need to ask question, right question. Time has come where we need to see result. We need to ask questions. Amavata dosh is your problem. Kumbhak can increase Amavata dosh or improve Amavata dosh, sorry. It can correct your Amavata dosh.
Swamiji, could you just check audio at your level and increase your input volume? In the meantime, Jan Pillai, can you hear me? Do you suffer from diabetic or diabetes problems? Give me a thumbs up. All right. So if I put you in spotlight, that is okay with you? Yes or no? No? No, I need to know whether you're comfortable with that. If you're comfortable, Swamiji can have a look at you and tell the problems. Otherwise, I'll select somebody else. All right. So, Gautam Kumar, can you put on your video? Gautam Kumar. Without the video, it doesn't work. Gautamji, I'm putting you in spotlight. I think you are very worried about the diabetic problems that you have. So unmute yourself. I'm asking you to unmute. There is a mic button below. So unmute karenge and tell about yourself.
Yeah, good evening, sir. It is a great opportunity to talk with you, sir.
Yeah. Please tell us something about your problem.
Recently, 2 days back, I diagnosed with diabetes. So, doctors given some medicine, but I don't want to use that medicine. I naturally want to reduce my diabetes. That is my question, sir.
Okay, you have a problem of something called as Udana dosha. Two things I'll say. Udana dosha and the second one is pituitary insufficiency. There is a gland in the hind side of the brain above the hypothalamus called pituitary gland. Because of pituitary insufficiency, what happens? Maybe the insulin releasing hormone that actually comes out of pituitary has got deviated, or there is an Udana dosha. That means you have a problem with the lot of activity in your mind and brain. Right? So that doesn't stop. There is a deviation in your mind at this point of time. it can become a little serious in the years to come if you do not work upon it. I don't want to scare you, but then you have to handle the problem. Lowering down the sugar level will not help. So Udana Vayu is basically a factor which moves upwards. So you have a very weak base, the Mooladhara, we can say Mooladhara, weak base. The lower part of your spine is very weak. So it impacts the brain too much. The whole movement is going towards the mind and brain. So the brain activity has a little deviation. It has a little deviation, and it can show up in many, many ways, like in hormonal insufficiency. One of the hormone is insulin releasing hormone, right? There can be other hormones also if tested. But then Udana Vayu, if we correct it by, see, thing is moving up. Now you want to hold it. How do you hold it? Somebody is pulling you from above. You want to pull it down. How do you pull that factor down? You will hold your breath and pull down, isn't it? Even if you get into a situation like spinning head, how do you hold yourself? You hold your breath and then you try to hold the ground, isn't it? That's how you hold. That's how you protect yourself. So Kumbhak is very essential if you really want to correct these two factors, right? So Udana dosha, one of the thing is Udana dosha. The next thing we can actually describe looking from outside is pituitary insufficiency. Both can easily be corrected through Kumbhak.
Thank you, Swamiji. Anupama Chauhan or Bina George. Bina George, would you be interested in getting spotlighted and see why you're having problems? First tell me, confirm that you're suffering from diabetes. Give me a thumbs up or give me a thumbs down. All right. If I'm not getting a thumbs up or a thumbs down, I'll move to somebody. Hari Ramamurthy ji. Hari Ramamurthy ji, I think you have multiple issues. Ma'am, I'm putting you in spotlight. Hari Ramamurthy ji. I'm putting you in spotlight. Unmute kare and tell us about your problem.
Namaste. Am I audible?
Yes, you are. Go ahead.
Thank you, Swamiji. I have had a bypass surgery in 2020. I've been diabetic for about 30 plus years. My HbA1c is between 7.5 to 7.7. Recently, when I checked my potassium level, it was at 5.1. The serum creatinine is at 1.23. I have been taking medicine for diabetic for about 30 plus years. Ayurveda in the beginning and later allopathy. I've been taking BP medicine for about 5 years. After bypass surgery, I'm also taking for heart health. This is somewhat, I'm 70 years old. I do regular exercise and walking. My energy level is not always very high, but most often I manage to activate myself by doing simple exercises. I do only pranayama whenever possible in the morning. I have heard about the Kumbhak, but because recently I have been told that I have proliferative diabetic retinopathy, I have not started with the practice of Kumbhak.
Okay.
Thank you.
Okay. First of all, the Kumbhak, which is mentioned in Yoga Kalachara or yoga, it is not about maintaining health. It is about samadhi or mukti or moksha. So yoga basically, the yoga factory, the product of yoga factory is samadhi or moksha or mukti. Now, if you want samadhi, you can practice yoga, but will it help you in getting better in terms of health? Maybe for some not. Now, exercising a little more by activating yourself because you are feeling low and you do exercise has actually increased your pitta. At this point of time, your pitta is aggravated, pitta vata dosh. At this point of time, the more you exercise you do, the more difficulty you will get into. It is pitta vata dosha. The Kumbhak that we teach is a part of Ayurveda, which has got eliminated or because of its complexity. Not many will be able to actually get the whole mechanics of Kumbhak. So we are reviving it as a part of Ayurveda, not as a part of yoga. Now, in you, the Pitta Vata dosha, one thing, the Pitta Vata dosha has aggravated. You have a Vyana dosha also. I'll tell you in terms of how you can check it. If you make any effort, you will get breathlessness. You will get breathlessness very easily. If you push yourself a little high, you will get into breathlessness. So, Vyana dosha, at this point of time, Pitta Vata dosha. Now, if you have not started with Kumbhak, good that you have not started with Kumbhak, because the Kumbhak in yoga is not designed for treatment. Right? If you really want to do Kumbhak, you will have to do that Kumbhak, which is a part of Ayurveda, not yoga. Now, Kumbhak, without Kumbhak, you can't get well. Let me also tell you. Because your breath hold capacity is less. That is why whenever you make effort, there is a chance of getting into breathlessness. So your breath hold capacity is weak. The moment you increase your breath hold capacity, you'll see, you'll start getting into some kind of an ease, which is not there at this point of time. So first improve your effort making ability, and then you can go for doing whatever kind of exercise that you do. You'll see it will not disturb your whole the balance of your body. So Kumbhak is a solution for you because Vyana means relaxing ability. Relaxing ability is Vyana dosha. At present, it is Vyana dosha. Pitta Vata dosha, that means your body gets very easily heated up and the body is not able to relax properly. Pitta Vata dosha, the relaxing ability of the body is very weak. If you just cool down your body, you'll feel at ease in your mind and body. At this point of time, if you just cool down your body, you'll feel at ease. But then you have to increase the Vyana Shakti. Vyana Shakti, relaxation, relaxing ability of the body, which is related to exhalation. If you strengthen your exhalation, you'll see your situation will become better. But then to strengthen the exhalation, you have to actually do Kumbhak. The strength of your inhalation and exhalation is is directly proportional to the amount of Kumbhak that you can do or the capacity of Kumbhak that you do. So if you do Kumbhak and if we just tailor made it to your weak factors that we do, because we do Pranashakti diagnosis where we check the weak factors in your body and then actually customize the Kumbhak according to your system. Right? So without Kumbhak, you'll not become better. But then how to do, what to do, in what formula, that is what we will actually design for you and then teach you.
Do we need more information from him, or is the diabetic program be okay for him for me?
We need a little more information.
All right. So, Hari Ram Murthy ji, please type in your number. Our team will get in touch with you and ask more details about you and then guide you to the right program. It could be between the diabetes or the BP program. Umesh ji, you have raised your hand. Please type your question. In the meantime, so this exercise is limited about being on the spot, being spotlighted and asking. So Vivek Tiwari ji has asked a question. I have had diabetes for 11 years. High BP 20 साल से है. Okay, BP पहले हुआ है. Had a heart attack 4 years back. Though I have maintained a healthy lifestyle with balanced food and daily exercise, I feel my body is getting weak. Blurry vision and tingling sensation in my soles. What should I do?
See, your idea about health may not be right. People think I've maintained a healthy lifestyle by correcting or taking the right kind of food. But food doesn't increase your strength. 80-year person have had 80-year diet regime, but has become weak. So food doesn't increases your strength. Food is a supply that your body needs, but then your body becomes weak and weak if you don't improve or if you don't work upon the basic strength factors of your body, which is a Kumbhak factor of your body. Now, apart from that, the idea of disease is also has been deviated, and we think sugar level is diabetes and blood pressure and so on. But there is no blood pressure as such. According to science, there cannot be a blood pressure. Either physics is wrong or your doctor is wrong. Choose between the two. Either science is right or your doctor is right. But then if you have created the idea for the last 50 to 100 years, how can it be taken down from the mind, from the mindset of people? So if you have a problem, basically most of the problem that we are facing at this point of time, the chronic disease, non-infectious disease, NID, they have a correlation with the metabolic strength of your body. If you do not improve your metabolism, you try to keep your sugar level to whatever recommended level or blood pressure to whatever recommended level, you're not doing anything good to your body. You have not increased the tolerance level. Let me give you one example. Now, if your sugar level can go up to 400 and come down to 50 and you do not face any problem, and suppose your sugar level goes up a little 10 points up and down and you face a problem, who is a weak person? Your sugar level, if it goes up to 400 and comes down to 50 and your body is able to tolerate, that's a very good sign. And if you can't bear even a 10-point increase and decrease in your blood sugar, you are a weak person. That is what everybody is trying to make you, or the current dispensation is trying to make you. Single line बनाना चाह रहे हैं ना सबको, तो मतलब dead, not even living. If you can't tolerate a little fluctuation of blood pressure, that means you are weak. And you are trying to become weak. Diabetes increasing or decreasing in the world? With whatever education or whatever kind of narrative that you have taken in, diabetes is increasing. Even kids are getting into diabetic situation. And I get a lot of kids who are insulin dependent diabetic. And by doing Kumbhak, they come out of insulin. But then it also depends upon the kind of damage that you have done with your body. Tell me, आज जितने लोग यहाँ पे हैं, is your body designed for chemical consumption? क्या पेट्रोल की गाड़ी में डीजल डालोगे? Will you put diesel in a petrol vehicle? Your body is not designed for chemical consumption, and you are putting incessantly chemicals inside your body. The moment a kid is born, how many vaccines and immunization, all chemical medium. We are putting chemicals inside this body. So the idea of disease is deviated. The idea of health is deviated. But you are all intelligent people, use your mind. Your body is the most appropriate diagnostic equipment that you have got. If you start listening to your body and see what the problems body is facing, what the indications body is giving, you will also be able to come out of any deviation in your health. So after doing Kumbhak, within a week or less than that, you'll start feeling more energetic. Guaranteed. That means your body is recovering. And when your body recovers, it needs a little more glucose. So a short-term increase in glucose is not diabetes. Now, the moment you go to a doctor and blood test is done, your sugar level is high. That doesn't mean you are diabetic. That means your body needs that kind of sugar level at that point of time. If you get into infection, any kind of a damage, any kind of stress, your sugar level will increase. It's a protective thing. But then if you give your body a little time, make yourself a little more healthy, within 6 months to 1 year, you'll come out of these deviations. But then if you start taking medicine, you'll never come out of diabetes. You're not even giving your body a little time to recover itself. So look for the right indicators in your body. When you start doing Kumbhak, what will happen? Your symptoms will reduce, will come down. Energies will increase. You'll be able to do more work. You'll be more enthusiastic towards your life. You will feel better within yourself. You'll be able to control your emotion better. You'll be able to handle stress better. These are indicators that you are recovering from a damage. So look for indicators of the body. Look for the improvement in the symptoms of the body. Look for what the body is trying to say. And you'll see you'll also be able to create a lifestyle which can actually recover you from your disease. The parameters that are available at this point of time, lab tests, they are question mark. Right? There are a lot of different studies which says different things. 8.5 HB1AC is not a severe situation, not a bad situation. Below that, below 8.4 to 8.5, you should not take any medicine. American College of Physicians, 2016 guidelines. You can go in the Google and see, but who is following it? There is a lot of question mark in how we are trying to handle disease because it is not decreasing by any mean, by any number. Instead, we are doing damage. Instead, human genome has got deviated in the last 100 years. By chemical bombing the human body, we have actually deviated the human genome. आप लोग ना म्यूटेंट हो, वीक म्यूटेंट बन गए और हमारे बच्चे तो और वीक म्यूटेंट बनते जा रहे हैं. तो अभी कुछ करना पड़ेगा.
Similarly, there are people who have multiple issues, whether it is diabetes plus thyroid, autoimmune condition, backaches plus diabetes. So, will they be able to come out of their conditions with Kumbhak Swamiji?
100% they will be able to come out. But then if you have multiple issues, you can share your number in the chat box in the WhatsApp group you're a part of. Then we'll take some parameters from you, your height, weight, disease, history of the disease, and then we'll try to we'll try to make an inference about what is the best program, what will be the best program for you, and how you should approach correcting all those deviations or disease that you have got yourself into. So you share your number, you put down your number, and then somebody will get in touch with you, and then we'll send you to or will direct you to the right kind of program.
Okay, this is a question about tips and hacks, which people ask. How to get burning feet? How can burning feet sensation be resolved?
One tip I have already given to you, that if you take any diuretic, your sugar level will go down. But then it will be risky for your body, right? So if you want to push your sugar level down, one tip. Now, if you're burning feet, burning in urination, if you close your eyelids tightly and you feel burning sensation, if your tongue is very reddish, that means your body is not able to bear the increase in the heat within itself. Pitta dosh, this is called a pitta dosha. So you can do a simple practice of Sheetkari, which is available online also. If you lie down upward down, that means legs up and head down. Within 1 hour, your body temperature will actually get balanced. clear your bowel movement. Your bowel movement should be proper. That means you take any kind of mm, stuff, Ayurvedic stuff, natural stuff, which can actually relieve your constipation. That will also cool down your body. The length of breath, if it increases, it will cool down your body. The more exhalation you do, it will actually cool down and relax your body. The more exhalation you do. Relaxation also cools down the body. Then if you eat anything which has a lot of watery stuff, that means the water content of your food should be very high. If you just leave grains and for 2 times a day, you just have fruits, your body will cool down. There are a lot of ways in which your body can actually cool down. If you sing a song which is like very soothing, listen to a music which is soothing, your body will cool down. If you play just not a physically stressful play, but just a little game with your friends and family, your body will cool down. There are many, many ways in which your body can cool down. If you cool down yourself, you'll see this burning sensation will go off. But if the momentum of this pitta dosha is high, then it will take some time. You'll have to take some Ayurvedic support. Better you consult an Ayurvedic doctor and take a pitta shamak medicine. There are many pitta shamak medicine. Ushira sab. If you take Ushira sab, pitta shekhar ras, sutta shekhar ras, maha there are a lot of stuff. Then I am very, very skeptical in saying certain medicine, because then if you take medicine without prescription, it may do something. Mahasudarshan Churna. Anything bitter if you eat, your body will cool down. So many ways, but then you need to understand how your body, what your body is indicating, and then better go to an Ayurvedic doctor and take some support.
Umesh Kumarji is really concerned about his levels. They are 120 to 140 fasting. His HbA1c is in the pre-diabetic range of 6.4. And after food, his levels go up to 150 to 200. And he wants to bring it below 6 and fasting sugar below 110. Though we have started the webinar about sugar level is not equal to diabetes, would you please, I think, throw some light on it so that at least his mind is rested?
See, I've already told you, if you want to push down the sugar level, take some diuretic. Take some support of an Ayurvedic Vaidya and take a diuretic. The sugar level will come down, but it will not solve your diabetes. Your energy levels will also come down. The ability of the body to recover itself will also go down. The recovery strength will also go down. So if you are really pushing down the sugar level, you're doing harm to your body. You're actually doing harm to your body. For whatever recovery your body does, it needs energy, isn't it? आप बताओ ना, आपका शरीर अगर कुछ भी रिकवरी करेगा तो उसको एनर्जी चाहिए ना, तो उसको शुगर चाहिए. आप शुगर डाउन कर रहे हो, अब रिकवरी कैसे करेगा वो बेचारा? आपने अगर अपनी आर्मी का हथियार ही छीन लिया तो वो आर्मी लड़ेगी कैसे? और इसको आप अच्छा बता रहे हैं. तो आपको कुछ पढ़ा दिया गया, आपने मान लिया उसको. आपने सवाल क्यों नहीं किया कि शुगर लेवल कम करने से किसकी डायबिटीज ठीक हुई है? आप सवाल कर सकते थे, आपने सवाल ही नहीं किया. अंग्रेज हमारे दिमाग को बर्बाद करके चले गए, मालूम है आपको? अंग्रेज हमारे दिमाग को बर्बाद करके चले गए और हम सुधरना नहीं चाहते. सुधरने के लिए भी तो एनर्जी चाहिए, शुगर चाहिए, नहीं चाहिए क्या? हम सुधरना भी नहीं चाहते, क्या करें? तो सही क्वेश्चन पूछेंगे तो पता चलेगा. किसी ने आपके अंदर अपना आइडिया डाल दिया. ये वैसे ही है रिलीजन्स ऑफ द वर्ल्ड ना. दुनिया में सबने रिलीजन ऑफ द वर्ल्ड, अब्राहमिकल रिलीजन्स ऑफ द वर्ल्ड. हमारे देश में तो कोई रिलीजन है नहीं, उन्होंने एक आइडिया ऑफ गॉड डाल दिया तो वही लेके घूम रहे हैं आज तक। हाँ, वही लेके घूम रहे हैं ना। तो होश कब आएगा समझ में? होश आएगा तो भी हेल्थ भी सुधरेगी ना। ये गुलामी कब तक चढ़ी रहेगी, इसका खुमार कब तक चढ़ा रहेगा, तब तक तो हेल्थ खराब ही होगा। बाकी ये हमने बता दिया आपको कि अगर शुगर लेवल कम करना है तो डायबिटिक लेके कम कर लो, बट देन इट विल ऑल्सो हार्म योर बॉडी। शुगर लेवल कम करने से डायबिटीज नहीं गई आज तक किसी की। अगर जाती तो आप करना चाहते तो हम भी बताते, वही चीज बताते। आज तक किसी की डायबिटीज शुगर लेवल कम करके गई नहीं, है ना। आपकी प्रोग्नोसिस कहते हैं आपकी आगे की लाइफ और खराब होती जाएगी। तो आपको ये सोचना, ये आपको सोचना है भैया, बॉल इज इन योर कोर्ट। हमने तो बता दिया आपको, हमने तो आपको सारी कहानी सुना दी ना, सारी मेहनत करके कहानी सुना दी। अब बॉल इज इन योर कोर्ट, आपको करना है नहीं करना है दैट यू डिसाइड। आपकी हेल्थ आपके हाथ में, आपको कहीं ना कहीं तो लेना पड़ेगा।
Thank you, Swamiji, for taking out time for diagnosis and answering a lot of questions.